Everyone slows down as they get older, both in body and mind. Some changes in memory or thinking that make it hard to get through the day are not a normal part of aging. These changes could be signs of early dementia. The word dementia is an overall term that covers many types of brain-related diseases and symptoms. Mixed dementia means you have more than one type of dementia at the same time. One common type of dementia is Alzheimer's disease. Dementia is caused by physical changes and diseases in a person's brain. Some symptoms include loss of memory and other thinking skills. The changes are severe enough that a person has a hard time doing everyday activities. Dementia can also affect people's perception. Living with Alzheimer's or other dementia brings demands to your life that can result in stress. In general, dementia is a progressive disease, meaning that it gets worse over time. Although symptoms may progress, a person can still live well with dementia. Talk with your healthcare provider and schedule a wellness check if you are experiencing or concerned about memory loss or related symptoms. An early dementia diagnosis gives you a chance to get care and plan your future. We know many health problems or behaviors raise the risk of dementia. A person may be more at risk if they are overweight, overconsume alcohol, smoke, have hearing loss, or have had a traumatic brain injury, even if it has been years since the injury. Other risk factors include having certain chronic diseases such as stroke, high blood pressure, heart disease, or diabetes. For the American Indian and Alaska Native AIAN populations, dementia is 3 times more likely than it is in the U.S. population for people over 65. The AIAN populations are susceptible to more risk factors and have health impacts due to a history of government policy and discrimination. This includes the loss of land, forced relocation, food transitions, tribal termination, and historical trauma. As a Native person, you and the people in your community have many strengths to draw on. The physical, mental, emotional, and spiritual aspects that keep us balanced also promote resilience, connect us to our communities and culture, and can help lower the risk of dementia. Things like healthy food choices, healthy behaviors, social connectedness, and participation in traditional practices are all protective factors. Healthy behaviors about tobacco use, diet and exercise, and alcohol consumption can reduce dementia risk. If you smoke cigarettes or chew tobacco, ask about medicine, counseling, or help to stop. Maintain a healthy weight for your body size and aim for 20 minutes of physical activity a day or 2.5 hours a week. Excessive alcohol consumption over a lengthy time period can lead to brain damage. Seek healthcare or support to stop drinking. Get at least 7 hours of sleep each night. Poor sleep quality and sleep disorders may increase the risk of dementia. Keep your heart and body healthy to protect your brain. Making healthful food choices for brain health includes eating local, seasonal, fresh food, eating less salt and sugar, and eating more vegetables, fruits, whole grains, and lean protein. Make an effort to choose foods with lower amounts of salt or sugar. Eat less red meat, and avoid highly processed or packaged foods. Reading nutrition labels is helpful because it provides information on the food you eat. It is also very important to be socially connected and active. It is an excellent way to remain independent. Social isolation is associated with about a 50% increased risk of dementia. Reach out to your elders at risk of being socially isolated to reduce their risk of dementia and increase their health and quality of life. Another way to reduce dementia is to participate in traditional practices. Some activities could include physical activity such as dancing, preparing, and harvesting traditional foods and medicines, or learning and practicing your tribe's language. Participate in cultural activities with elders, such as beading, practicing songs, and connecting youth and elders. In addition to maintaining physical, mental, emotional, and spiritual balance, make regular visits to your doctor. Be sure to talk to your doctor about how you feel, because your mental health can affect your brain and overall health. It is also important to take your medication as prescribed if you have high blood pressure, diabetes, and other problems, even if you feel good. Take steps to decrease dementia risk. Make sure healthy goals are doable over time and are not too hard to accomplish. An example of a change would be, I will eat 1 piece of fruit at breakfast 3 times this week. Historically, we had kinship systems and social rules that protected vulnerable persons. Let us continue this tradition by keeping them safe. Sometimes elders are hesitant to talk about memory loss or dementia, which can delay diagnosis and treatment. Encourage them to continue to pass down their values and knowledge in connection with the land, traditional medicine, spirituality, traditional foods, traditional activities, and language. Elders living with dementia can continue to be active leaders and storytellers.